Good afternoon and welcome to the Office Hours Quality Payment Program. My name is Brandon and I'll be your operator for today. At this time, all lines are in a listen-only mode. Later, we will conduct a question and answer session during which you can dial *1 if you have a question. I will now turn it over to Mona Matthews. Mona, you may begin.
Thank you, Brandon. Hello, everyone. This is Mona Matthews. I'm a project specialist in Wisconsin with Lake Superior Quality Innovation Network, serving Minnesota, Michigan, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. I would like to welcome you to this session of the QPP office hours. As mentioned, today's call will be operated assistant, and by default, everyone's phones are currently muted to avoid background noise. Since this is an open office hours call, there will be opportunity to ask questions over the phone, at which time I will ask our operator, Brandon, to give some instructions. We will also closely monitor the chat box and encourage you to post questions and comments throughout. Also, please note that the information provided during this session is based on the latest information made available by the Centers for Medicare and Medicaid and is subject to change. CMS policies change, so we encourage you to review specific statutes and regulations that may apply to you for interpretation. At the end of the office hours, you'll have an opportunity to complete a brief evaluation. We would appreciate your feedback about this event and suggestions for future educational opportunities. We'd also like to remind those of you that receive direct technical assistance related to the QPP to please take the time to complete the evaluation sent at the conclusion of each technical assistance encounter. Your feedback is very valuable. Also, I would like to mention that during the office hours calls, we typically can address a broad range of questions which are based on the equally broad range of QPP NIPS knowledge level of our call participants. Some questions we will be able to answer quickly. Others may require some additional time to research due to the complexity of the question, while others will be very scenario specific to your organization. We will be sending out a Q&A document within the next couple of weeks with all of the answers, even those that we have to do a little bit more research on. With that, I'm going to get started with the agenda, just to review that. The first thing we're going to do is I wanted to review some real basic things that came out and some new resources. Now, on the agenda that's displayed on the screen, there were some new videos that came out last week, and many of you would have received an announcement about this from your prospective states. There's a video that's about 7 minutes long on how to request a targeted review. This is really not new information. The targeted review fact sheet came out a few weeks ago, but this puts it in a different media. It's the same thing with how to access performance feedback for APM entities and also how to access performance feedback for individuals. I've also included in the agenda a link to a payment adjustment infographic for your review. Today we're going to briefly review some of the high-level quality payment program facts. We're going to talk a little bit about the feedback reports, the targeted review process, the payment adjustments, and really briefly we're going to touch on the proposed 2019 rule. And we hope to be able to give you at least 35 minutes of Q&A, at which time I'm hoping that many of you will have some good questions, or if you've got information that you think would be valuable for all of our listeners, please share your experiences at that time. With that, I'm going to get started with the presentation. So just a really quick disclaimer, and I read some of this before in the introduction. The content provided in this presentation is based on the latest information made available by CMS and is subject to change. CMS policies change, so we really do encourage you to look up the statutes yourself or give us a call and we can help you with that. So just some really brief changes and high-level things about what's different from last year to this year. I think most everybody is pretty familiar with this slide, that in 2017, that low volume threshold was $30,000 Medicare Part B and those N100 patients or beneficiaries. For 2018, that increases to 90,000 and 200 beneficiaries. And as always, voluntary reporting remains an option for clinicians exempt from MIPS. And this is just, you'll receive a copy of this presentation. This slide just contains some links to those fact sheets that I mentioned before. Some of these slides were presented last month too, but we wanted to just really get them out there again. So this is a list of the individuals who will have a performance feedback, and it's the individual clinicians, groups, the APM entities, the MIPS alternative payment models, and clinicians who practice in multiple groups will have performance feedback for each group. Partial qualifying APM participants will only receive MIPS feedback if they elected to participate in MIPS. So information in the MIPS performance feedback report, you'll find the final MIPS performance feedback will reflect special scoring circumstances and all the MIPS data submitted or calculated for the individual clinician group or APM entity. This may differ from the score that you saw when you were entering, or if you logged in with your EIDM account prior to the reports being finalized. Some of this was not included, so they did update everything when they made those final. You'll receive the 2017 final score in there, along with the payment adjustment. And then also details about each of the measures and activities and how you scored on those measures and activities. And this is just an example. This is an example from CMS, so you'll note that the payment adjustment here says 2%. And we know if you logged in that at 62.9, you did not get a 2%. It was much lower than that. But this is what the report format looks like. And then for the category score as well. You will receive feedback on the cost category in your feedback report. It'll be measure level scores for information only, as you note that the score would have been multiplied by 0 to get your score because it was weighted at 0 for this last year. And just another reminder, and I know we've reminded everyone about this before, to get your MIPS performance feedback, you'll log into the QPP website, the website that we take you to for many of the technical assistance. It's qpp.cms.gov, and you'll log in with your Enterprise Identity Management, or EIDM, credentials used to submit and view data during the submission period. If you do not have an EIDM account, you should start that process as soon as possible. CMS encouraged everyone to get that done by July 31st, but you can still do that. And at the bottom of this slide is a link to a quick start guide that we put together here at Lake Superior Quinn for people to log in to get started with an EIDM account. And also just feel free to call your prospective state and we can help you. So this is the list of the new videos that came available just last week. And again, you may have received a notice from CMS or from us that these are videos available, and some of it's the same information that was released in the fact sheets weeks ago, but it is in a different media. So if you like to learn from videos, it might be a good option. So also we're getting a lot of calls about people questioning their scores and whether or not it was calculated correctly or if there's a mistake. There is a targeted review process that you can go through in order to have your score evaluated. You are encouraged to request a targeted review at the same level, either individual or group, as the data was submitted. And possible reasons you might want to do that is calculation errors or data quality issues. If you think there was an error made in eligibility being wrongly assigned to the MIPS eligible clinician or group, you should file a targeted review. Or if the eligible clinician did not receive automatic reweighting. So if you had a clinician who is eligible for automatic reweighting in the promoting interoperability category, you should file a targeted review if you think that they weren't reweighted. And those are clinicians, nurse practitioners qualify, or clinicians that are non-patient facing. If you think that you have a clinician that was erroneously excluded from the APM participation list, you're also asked to do a targeted review at this time. Okay, some of the things that are beyond the scope of a targeted review, you cannot file a targeted review. If you do, they'll say that no change, or they'll let you know that they can't do anything about it if there's a methodology used to determine the amount of MIPS adjustment factor. Establishment of the performance standards and the performance period, identification of measures and activities, information made public on Physician Compare, and the methodology to calculate performance scores. These would be things that would be beyond the scope of a targeted review. So requesting a targeted review, and as I mentioned before, there is a fact sheet out on that, as well as you can refer to the video for the instructions on how to do that. But you should submit your targeted review request immediately. The deadline is October 1st. That was changed. Originally, I believe it was September 30th. But you can do that at any time. And again, look at that user guide. People are getting replies to these targeted reviews within a couple of days. So you don't have to wait till after October 1st to get the review. And you'll do this by logging into the Quality Payment Program portal. You'll need your EIDM account credentials. And at the bottom, I believe with each score, you can scroll down and it'll give you a button that asks you if you want to submit a targeted review. And you'll do that and follow the instructions. Just as I'm going to transition just a little bit to the 2019 proposed rule. For those of you who are not aware, the 2019 proposed rule was released probably about 3 weeks ago now, and it was released as part of the Medicare Physician Fee Schedule, or PFS. Just some real high-level things. The proposed rule reflects that MIPS is continuing to ramp up. They have proposed to add some new eligible clinician types. They also, potential incentives and penalties increase, which is no surprise. I think that was the direction that MIPS was going. And this is the proposed rule, and CMS is still accepting comments. If you have not looked at the proposed rule, you may want to do that. And within the proposed rule, it does tell you how to submit comments. And on the QPP website, there is also a fact sheet, I believe, for the 2019 rule and some instructions on submitting the comments. So high level, what's not changing, what they're not changing, they're proposing to change for 2019. The performance period is still January to December, so that calendar year. The reporting period will be that first quarter of 2020. And the payment adjustments then begin 2 years later, the same as it has been for the last couple of years. The performance periods are not changing. As we all know, this year the quality and cost need to be reported for 12 months. Cost is, there's nothing to submit, that's done via claims, but quality data will need to reflect the entire calendar year. Improvement activities and promoting interoperability, they are proposing to keep those as 90-day minimum reporting. You can do anywhere between 90 and 365 days. They have not changed the types of exemptions, so those newly enrolled Medicare folks will be exempt. Those that are below the low volume threshold, there's a little change they're proposing with that I'll get to in just a minute. And those that are significantly participating in advanced APMs. So this is not changing. There's no proposal to change these things in 2019. Some key changes, the category weights change slightly. They're proposing to increase the cost and decrease quality. The newly eligible clinician types are physical therapists, occupational therapists, social workers, and psychologists. And they're increasing the performance threshold, incentives, and penalties. So this year that performance threshold in order to stay neutral is 15. They are proposing to raise that to 30 for 2019. And they are limiting the use of claims-based measures. They are proposing that they limit that to small practices only, so it'll go away for the larger practices. And the last bullet here is pretty significant for many. They are proposing that the cert requirements that you must be 2015 cert in order to report in the promoting interoperability. So those are just some high level. There's a lot of detail, and probably next month we'll focus, but if there are questions, if people have some questions, I'm happy to attempt to answer some of the more specific things about the proposed 2019 rule. As I mentioned, the 2019 rule was released along with the proposal for the physician fee schedule changes. This is not really in our within the scope of what we provide technical assistance for, but I thought it was important to just point out some of the major changes within that proposal, because it's something that will affect many of the clinicians. So the major changes, they are trying to modernize Medicare payment policies to promote access to virtual care. So there's a lot of things within that proposed rule about paying for and adding codes for virtual care. You can think of like telemedicine and expanding some of that type of work. They are streamlining the documentation requirements for physician services known as evaluation and management. Kind of high level here, the proposal includes, those of you who are familiar with E&M codes, we now have 5. They are proposing to reduce that to 2. So it's a single blended payment and then a single blended payment rate for both new and established patients. And then E&M level 2 through 5, that would all be one code instead of multiple codes. Add-on codes to reflect resources involved in providing complex primary care and non-procedural services. And they are also, they're really pushing to reinforce the CMS patient over paperwork initiative and focus on reducing administrative burden. Within that proposed rule, they're cutting the amount of documentation for those E&M codes. I don't claim to be an expert on that, but it's worth looking at if you are someone who has that within your role in your organization. And if you have questions, I can point you to the right the area of the proposed rule for that. So with that, just my name again, Mona Matthews. I'm in Wisconsin, and our website is www.lsqim.org. And at this point, I'll ask Brandon to remind people how to get into the queue for a question, and we'll open it up for questions and any questions you have on the quality payment program.
Thanks, Mona. We will now begin the question and answer session. If you have a question, please press *1 on your telephone keypad. If you'd like to be removed from the queue, please press the pound sign or the hash key. There may be a delay before the first question is announced. If you're on a speakerphone, please pick up your handset first before dialing. Once again, if you have a question, please press *1 on your telephone keypad. And we do have a question on the line. If you could state your name and your question, that'd be great. So the individual that queued up for a question, your line is open. Please go ahead.
Hi, this is Lois from Hutchinson Health. And we noticed when we're reviewing our providers and we were looking at the different points that they received, that there was an area that said partial points with their quality measures. We were wondering what that means and how somebody would obtain partial points.
Lois, this is Mona, and I was really having a hard time hearing you. I don't know if you're a long ways from your phone, but I think it has to do with some partial points for quality.
That's correct.
And is it for specific measures?
So, for example, if we submitted a quality measure for diabetes and our fell within the decile for 9 points, for example. There's also listed underneath there that we earned 0.5 partial points. We didn't know what that meant. You would think that you just fell within the decile where you earned 9 points.
Yeah, that's, I'm not familiar with the partial points. If that has something to do with the possibly bonus points, but I'm not entirely sure. But we can research that. Was it Lois?
Yes.
Which state are you in, Lois?
Minnesota.
In Minnesota? Yeah, we can certainly look into the partial points and get back to you on that.
Okay, thank you.
Yeah. Thanks for the question, though. Interested to know if there's anybody on the line, anybody else who saw that on their report. That's always helpful to know if it's not just one organization.
Okay, and once again, if you have a question, please press *1 on your telephone keypad. And we're standing by for anything further.
There is one question in the Q&A that I'll cover while we're waiting. The question is, for proposed Rule 2019 and improvement activities, do we still need to have one provider in the group participated versus the entire group? For 2019 and the improvement activities, it stays the same for group reporting. So for 2017, 2018, and 2019, I believe this question, what is being asked, it refers to if you do group reporting, if one clinician does an improvement activity, the entire group gets credit for that improvement activity in the total score.
And we do have another question on the phone. Please go ahead.
Hi, my name is Gal Bang. I'm with Hennepin Healthcare, and I had a question regarding the all-cause hospital readmission data in the 2017 performance feedback reports.
Go ahead.
I'm trying to figure out, I did call QPP, the phone line, and they weren't as helpful. What we're noticing is that the information around our hospital-wide readmission data does not match with our quality net readmission rates that we get. And so we're trying to figure out where they're pulling these codes and how to validate this information.
Okay. And obviously you had the right number of minimum cases to be in that measurement. So they're giving you that measurement, right?
They are. They gave it to us, and when I called, because the only report that we got was the data service was July 1st of 2016 to June 30th, 2017, the hospital-wide readmission data. That does not match with the results that are in the portal. And the only thing that they referenced me to was a zip file that had some information about hospital-wide readmissions, but there was no timeline, there was no codes. The codes do not match what we get from the QualityNet, and so I'm just wondering if others are looking into this or know more information or can point me into the right direction.
Yeah, I think it's a great question. It's not one that I have dealt with at this point. But yeah, I would open it up to the rest of the group if they saw similar, if people are seeing that discrepancy between different sources of data, or if they've received anything from CMS of where they pulled the data from. I mean, we can certainly look into it as well.
Okay, once again, if you have a question or a comment, please dial *1. I'm sorry, Mona.
No, that's all right.
Okay, and we have, I believe it was Don on the line. Please go ahead.
Oh, yes, this is Don with Health East in St. Paul. Question for Mona and the group overall. As we're reviewing our performance feedback for the 2017 NIPS attestation, we have found in the last couple of weeks that our score has actually changed. Just wondering when those scores are going to be considered finalized. We assessed our performance on July 30th. We had a 100% score and a 2.02% payment adjustment. Looked at it just 2 days ago, and it dropped down to 87.46% and a 1.33 payment adjustment. Just curious if anybody else has seen this kind of fluctuation in their performance, or if this is common, or when it's going to be considered final.
Don, that is a really good question, and you're not alone. I've had other people who have logged in multiple times and getting different scores, and also just the whole look of the report looking different.
Exactly.
You know, things in different areas, it's not exactly the same each time they log in. I will submit a question to CMS on that just to ask them. I mean, we were told that on June 30th they were final, but I know for a fact that many people have seen changes in their report since then.
Okay, yeah, I'd appreciate it if you could ask that question.
Yeah. You're not alone, Don.
All right, good. Nice to hear that as well.
Yeah.
Thank you.
Yep.
Mona, this is Tisha in Michigan. I was wondering if the previous question about the all-cause readmission data, what state she was in?
She was in Minnesota.
In Minnesota? Okay.
Yep.
Okay, standing by for further questions. Nothing so far. We'll just give it a couple more seconds here.
Okay. I do have an answer or a statement in the chat from someone about the partial points. So they were told that the partial points reflect points awarded when you fell in between a decile. For example, if you were between the 9th and the 10th decile, you could have earned 9.5, for example, versus just 9 or 10. The partial points are the decimals within the decile, which would certainly make sense. Thank you, Linda, for that.
Thank you, Linda. This is Tisha from Michigan. That was also my understanding, too. I think it was just difficult to hear the caller. I wasn't sure if that's what she was asking, but yes, I have seen this on a couple reports.
Yeah, that's what I thought too.
Okay, well, it looks like no further questions at the moment on the phone.
Yeah, I would welcome people to also make any comments about the 2019 proposed rule, or if there are things in there that kind of you would like us to submit. We are submitting comments for the proposed rule. We'll be submitting those as a Lake Superior Quinn. If there's things that you think are very concerning or things that you think are great within the proposed rule that you're submitting comments or would like us to maybe submit a comment, we might be able to do that. So I'd be interested to hear from people on that.
Okay. And just a reminder, it is *1 to get into the queue.
Tisha, do you see anything in chat or Q&A?
Nope, nothing new.
Okay.
Okay, and we have Don back on the line. Go ahead, sir.
All right, sounds good. Thanks.
Don, your line is open.
Sorry, I was on mute there. Question for you, Mona. Kind of reviewing the proposed rule, one of the concerns that we have here is the requirement or the proposed requirement for the prescription drug payment program, where you actually have to report when certain drugs are prescribed. I guess
Yep.
Prescribed drug. Looking for a little bit more clarification on that proposed rule and how we're supposed to be reporting that. Is that going to be through an interface? Is it through some sort of licensing? Is it to the state specifically, or are these kind of like private reporting models? Yeah, any insight that you have on that would be appreciated.
Yeah, and I'm not sure, like in Wisconsin we have the prescription drug monitoring program at the state level, which I'm thinking probably in your state as well, Don.
Okay.
And whether it's through that mechanism that we would report, but we have some of the same, in a meeting that I was in yesterday, some of the same questions is just how is that going to be operationalized and reported? Because it doesn't, the proposed rule doesn't get into that real well.
Mm-hmm.
It's a little ambiguous, and I think if they adopt that, it would be good to have it a little bit more clear.
Well, how does it work in Wisconsin right now? Do you have an interface that you submit through, or is it through some other means?
Well, it's the prescription drug monitoring program for the state, so all of the clinicians are part of that. So it's mainly just for opioids at this point, for opioid prescriptions. So they log in and they can see if the person has received opioids from a different clinician within the state.
Okay. And how does that information get to the state?
That I'm not sure of,
okay.
How it exactly works.
All right. Yeah, I'm just kind of.
But maybe somebody on the line from Wisconsin, if there's a clinician, maybe they're aware of it. But the clinicians in Wisconsin, if they are prescribing opioids, should be using that. Tisha, did you have something to add?
No, I'm not sure. Go ahead.
Oh, this is Lisa. I did join the call a little late. I'm sorry.
Right.
As far as the prescription monitoring programs, clinicians need to register. In fact, in Minnesota, it's mandatory that clinicians register for the monitoring program. So I would assume, I'm not sure if that's a federal or a state requirement, but they have to register and they should use it when they have a question about opioids.
And then again, how does that information get to the state? Is it some sort of batch submission? Is it an interface?
No, all pharmacists who dispense medications have to report to the state what they dispense. If where there's been a little bit of a catch is if people have paid cash or are not in the program, are paying cash for their opioids. But I'm not sure if that got changed or not. But for the most part, if they're dispensing, they have to report it.
All right. And then how is the provider supposed to be able to look this information up? Is it, again, through some sort of interface, or is it through some sort of...
Yes, it's an interface.
Okay. And is there a fee for using that service?
No.
Okay. All right. Thank you.
You're welcome. Thanks, Lisa.
Sure.
Okay. And once again, if you have a question or comment, please dial *1.
Lisa, prior to you joining the call, we heard from someone on the all-cause readmission, and the data that they received, or the evaluation was from July 1st to June 30th, but it doesn't match the information on QualityNet. Do you have any insight on how that, where that's being pulled from?
The all-cause readmission is administrative claims, and I thought it was for a calendar year, unless it's I'm surprised it's July through June. I was expecting that what I have known is that it was going to be a calendar year, and that comes from CMS administrative claims, and they have a whole process to assign, beneficiaries and, to attribute to clinicians.
Is that process different than what QualityNet uses? This caller was, and I think she was this from Hennepin County? Maybe if she could come back on.
Yeah,
Okay, we do have a line in the queue. Please go ahead.
Hi, this is Gal with Hennepin Healthcare. I had that question.
Yeah. So, and you had that, it said on there that the evaluation period was July 1st to June 30th, correct?
Not in the QPP portal. The only data that we have available when we look at our all-cause readmission measures for the entire system, the date is July 1st, 2016 to June 30th.
And where do you get that data from, that July through June?
It's available in QualityNet. That's the most that we received.
Oh, gotcha. CMS actually does it on a calendar year. And what's available to you is just giving you a little idea what could be coming for the rest of the year.
Okay.
So would it be accurate, Lisa, to say that what she's seen in the QPP portal is not going to match QualityNet for that reason?
I guess I'm not 100% sure how QualityNet updates their information and how often they do, so it just depends on that. But I know that for the QPP purposes, it's a calendar year. But so it could change if they're using different time frames.
Are you familiar with the codes that are given? Because we found that the codes don't even match, or we want to try and validate the data as well. And if it doesn't match, then we want to request a targeted review.
I guess I would request a targeted review and really find out where they're getting that data from.
Okay.
And that might be the best way and response to do that is, if you're getting different information than what you think you have, you can request the targeted review.
Okay. Thank you so much. I appreciate it.
Sure.
Are there any other questions?
It looks like nothing on the phone so far.
We'll give it a couple more minutes before we end the call today, if there's anybody else with any other questions.
Hey Mona, this is Tisha. There's nothing new in chat and nothing new in the Q&A section.
Thank you. One more call for any other questions. You can put those into chat or on the phone you can ask your questions. We do have about 15 minutes left in our scheduled time today.
And once again, it is *1 to get into the queue.
Well, hearing no other questions, we can end a little bit early today, and I'd like to thank everyone for joining us. And we ask you to please take a moment to complete the brief evaluation that will appear when you close out of this webinar. Your feedback is much appreciated and is used to inform our future educational offerings and resource development. Today you'll be automatically redirected to that evaluation, so please take a minute just to fill that out. And I want to thank everyone for your attendance, and if you have any other questions or things you need help with on the QPP, please don't hesitate to reach out to your your Lake Superior Quality Innovation Network contact person. Thank you. This ends our call.
Thank you. And ladies and gentlemen, this concludes today's conference. Thank you for joining. You may now disconnect.